hold on, let me see something. I think I put it on standby. Here we go. Then here's your clicker, and then here's your oops, it's not on yet. Clicker, and then laser pointer. Okay.
Good morning. I hope everybody can hear me in the back. Yes. First of all, I want to thank Jeff Emke for that great introduction and talking about great ER doctors. Jeff is just an amazing guy, and we're in good hands having him as the director in the ER. Thank goodness for that. I'm excited about this talk. I do have a disclosure here, and it says, I do not have any financial interest, and I do not anticipate discussing any unapproved use of commercial products, devices during this presentation. All right, I'm excited to be here and talk about nutrition. Let me start by saying a little bit about integrative medicine. Why does it matter for primary care physicians and family doctors to know about integrative medicine? Well, it turns out that on recent studies, about 70% of our patients are using integrative medicine some way, somehow. They spent $30 billion on this in 2012. And unfortunately, most haven't really told us they're doing it. They're not telling us that they're taking St. John's wort. They're not telling us that they're getting acupuncture from somebody in the community. They're not letting us know that, and that can be very important. The other thing is that it works. When you combine, integrative medicine is really combining the best of standard traditional medicine with some other things, great nutrition, some supplements, some relaxation techniques, other modalities. For osteopathic physicians, the hands-on stuff. For me, acupuncture, those kind of things. And when you bring it all together, I think you can get optimal outcomes for people. So this is the reasons people said they use CAM. And they said that they thought sometimes conventional medicine was too expensive. They thought that it was interesting to try. And then I think most importantly, they said at the bottom, and this was the most frequent response, was that they thought it would help their conventional medicine work better. And I agree with that, and I'm glad that they're thinking that. And you might be aware of this, there's integrative medicine centers popping up all over our country. These are centers that I know of, and I've read about what they're doing at places like Duke and Mayo and Harvard, Cleveland Clinic, et cetera, even at the Maryland Shock Trauma Center. 33% of academic medical centers are using now integrative or have centers of excellence in integrative medicine. I listened to a talk by the leader of the integrative center at the Mayo Clinic. His name is Dr. Bauer, just a couple weeks ago. And he said that they're routinely using acupuncture now before surgery. First started in the cardiothoracic surgery department, and they did so well, the patients used less antiemetics. They used less pain medications afterwards, and they got better sooner. Now they've incorporated into their general surgery as well. The other thing you mentioned at the Mayo Clinic, and I think most of you know this, that they do these executive physicals there. You can go there and kind of get everything looked at, seen by a primary care doc, a cardiologist, a rheumatologist, whatever you need, all in a few days. Now you can check off whether you want to see an integrative physician at the Mayo Clinic as well. The Cleveland Clinic just put many $million into their integrative functional medicine department, and the Cleveland Clinic was just ranked the second the second best hospital system in our country. I want to say a little bit about the integrative program here at Capital Region Medical Center. So I did a fellowship in integrative medicine at the University of Arizona. It was a 1,000-hour program. They export that program and they condense it into a 200-hour program, and they partner with many different facilities around the country. Mostly primary care, family medicine. Sometimes it's internal medicine, even physical medicine, and there's a 200-hour curriculum that the residents get on top of all of their other work, so they have to really commit to this. And if you look right there in the middle, Capital Region Medical Center, we were the second one in the state of Missouri. Now there's 5 in our area. There's one at Cardinal Glenn in pediatrics. There's one at the University of Kansas Pediatrics. There's family medicine at UMKC. And many of these other places are at academic medical centers, the University of Washington, University of Texas, Stanford. University of Connecticut, all over the country. There's about 50 of these programs now. Okay, so on to food as medicine, and this is what Hippocrates said some 3,500 years ago, that our food should be our medicine. This is a study that many of you who've heard me speak before have seen. This is the EPIC Potsdam study. It was published in 2009 in the Annals of Internal Medicine. And they said if you do four things, if you eat vegetables every day, if you move daily, if you maintain a healthy weight, that means less than obese, body mass index less than 30, and you don't smoke, that you can reduce the risk of diabetes by 93%, reduce the risk of heart attacks by 81%, reduce the risk of stroke by 50%, and the risk of cancer by 36%. There's nothing else in medicine that is anywhere near that powerful. You know, when you think about statins, how they can reduce the risk of a heart attack, sure, but it's not an 81% decrease by far. There's power in prevention. So when we look, today we're going to look at the macronutrients in this first lecture. In the second lecture, we're going to look at micronutrients. We're going to talk about fats. And the reason I chuckle a little bit is, have you seen all of the research recently about fats? I think you'll be amazed at some of the things, like the USDA guidelines took off the restriction, and we'll go over this specifically in a minute, the restriction for how much fat you can eat in a day. No longer a restriction there. The USDA guidelines, that's really moved how we eat and what foods are available in our schools and obviously in our grocery stores, started in the 1980s. And at that point, it was all fat was bad, basically. And with that, the dietary guidelines, they said replace fats with carbohydrates. Well, what happened there, and we see this in our practices, is that we see a lot more type 2 diabetes. We see a lot more obesity. And we see people eating a lot less fats, and it turns out, and then I'll show you, that many of these fats are very healthy for us. This was a Time magazine cover in the early 1980s. I bet you some of you remember this cover. So in 2016, there's a new Time magazine cover, and it says, "Butter is back." I'm going to clarify that some in just a minute. Scientists say, and this is on the cover of the magazine, scientists labels fat as the enemy. And in this article, they talk about why they were wrong. So fats, they're not a four-letter word anymore. This is the Wall Street Journal in 2014, and this is a big article in their health section. It said the questionable link between saturated fat and heart disease. There is a questionable link. It's not as clear. It's not as clear as we once thought it was. This is the journal Advances in Nutrition. Saturated fat is not unhealthy, they said in 2013. The influence of dietary fats on serum cholesterol has been overstated, they said. Consequently, the dietary recommendations to restrict saturated fats in the diet should be revised. So anybody out there that's having some bacon this morning, it may be a reasonable part of your diet at least once. So these are the new dietary guidelines, 2015 to 2020. JAMA introduced these guidelines in 2015, and it said that it is warranted to move away from total fat reduction. Further in 2015, according to these guidelines, we should actually decrease added sugar. It should be less than 10% of our calories. They will remove the upper limit on fat. It used to be at 35% of calories. And we'll remove the upper limit on total cholesterol, because we know in the vast majority of us in this room and around the country, cholesterol that we eat makes very little difference in our risk for heart disease. There are a few people that it does, but most it does not. And some of you may be thankful about this, I know I am too, that there's no issue with coffee. And in fact, people that drink 3 to 5 cups of coffee a day seem to do better than many other folks. And one of the reasons that is it revs up the cytochrome enzymes in the liver, the phase 1 and phase 2 detoxification. These people get less Parkinson's disease that drink coffee. And this was one of the issues. This is the Predimed study. And what they did in the Predimed study is this was in Europe, and they took a large group of people. Everybody was eating the Mediterranean diet, a healthy diet. The one group, they said, we want you to have an additional 30 grams of nuts or an additional 4 tablespoons, that's 400 or more calories of olive oil a day. And within just a couple of years, there was a 30% decrease in cardiovascular events in the folks that had the increased fat. Increased fat. In the Mediterranean diet, olive oil makes up about 30% of their calories. Olive oil is unique because it's green. You know, good fresh olive oils are green. They have these polyphenols in them, and these polyphenols are amazing antioxidant properties that actually lower endothelial cell inflammation and decrease the likelihood of plaque formation and plaque rupture. This is a study on olive oil in cancer, breast cancer. And they said that, I'm going to have to read this one. The first study showed that 68% decrease in risk of invasive breast cancer. The second study showed that if women were increase their olive oil after they've been diagnosed, that they had a significant decrease in the recurrence of the cancer. Olive oil it's amazing in all of the things it can do, and a lot of it's got to do with its antioxidant properties. Okay, this is another study. Does anybody know who Dr. Ansel Keys is? He's the nutritionist, lived to 100 years. He was from Minnesota, and he developed the K rations for the Army in the 1940s. In the 1950s, he got it in his mind when there was just a huge amount of cardiovascular disease that was occurring. He got it in his mind that fat must be the cause of it. So he did this study. We'll get that. He did a study called the 7-country study, and I'm going to talk a little bit more about that later in the cardiovascular talk. But in this 7-country study, he showed the more fat the country ate, the more cardiovascular disease they got. This is a second study he did, and it's called the Minnesota Coronary Experiment. And what they had was 2 different institutions. One institution, they let them eat the normal diet in the 1960s, lots of saturated fat, bacon and eggs, etc. The other diet, what they did is they removed the saturated fat and they put polyunsaturated fats in there, things like corn oil and safflower oil. And then they followed them for about 5 or 6 years. Okay, so they had these control populations that they knew what they were feeding them. And they found that the group that was eating the sunflower and safflower and the non-saturated fats, cholesterol was much lower. So they're going, yes, yes. But what happened is that there was actually an increased mortality in that group. They had more cardiovascular disease in the group that had a lower LDL cholesterol. And then what Dr. Keys did, and Dr. Keys is infamous now for not publishing this data. What he did is he held the data back because it didn't go along with what he believed, right? Held it back. And it wasn't until last year where researchers from the BMJ went to the University of Minnesota, went to the archives and pulled the data out and found that this was exactly what happened. The saturated fat group actually did better than the ones with a low saturated fat, the vegetable oil group. This is a big deal, and it changed. It's one of the things that really changed policy in the 1960s that led to the USDA guidelines in the 1980s that we should be eating low fat. Changed what we do in medicine. Okay, so does this mean that we should have a grass-fed steak and call the doctor in the morning so that steaks are just fine? It's more complicated than that. It's more complicated. One of the problems with this steak is if you throw a steak on a grill and you sear it, there's these heterocyclic amines that occur that are clearly carcinogenic. There's no question about that. There's no question. There's certainly saturated fat, and I think for most people, a modest amount of saturated fat that you get in that meat is probably just fine. Dr. Walter Willett is our nation's most respected nutritionist, and this is a diagram that he wrote. If you look at the top, the fats and the food components that we know are dangerous for us are trans fats, increasing cardiovascular disease. We also know that refined starch and sugar. In the middle, which is kind of neutral, are saturated fats. And at the bottom, when we get into whole grains and beans and lentils and vegetables and olive oil and nuts, clearly beneficial. Absolutely no question about that. So this is the summary of about fat. So let's move to carbohydrates. Did anybody see this paper recently in JAMA about sugar? And I say that like sugar. So this also was in the 1960s. Big money drove some of these things. So what happened was in the 1960s, sugar industry started to realize that there were study after study coming out about sugar causing coronary disease, right? So they paid two scientists to publish a paper in the New England Journal of Medicine in 1967 that tried to refute all of these studies, all of these, kind of like the tobacco industry was doing in the 50s and 60s, okay? So this is just published in JAMA, and they said, paid Harvard scientists to publish a study blaming fat and cholesterol for coronary disease. This too changed what happened in medicine and healthcare policy and food policy for the next 50 years. $50,000 they were paid. That's a lot of money back then. I put this slide up just because sugar is in a lot of our foods. Added sugar is a real problem for obesity and diabetes and coronary disease, and it comes by lots of different names, from lactose to dextrose to sorghum syrup to golden syrup to dextran to lactose. I mean, for the average consumer, it's hard for them to know how much sugar they're getting, particularly if there's a little bit of each in all of these. You know, if there's a little bit of, or a few of these as the ingredient in their food. So fat intake and obesity. In the 1960s, the average American ate about 43% or 44% of their calories from fat. Now, after 2000, we eat less than 35% of our calories from fat. And you can see how as the fat went down, obesity went up. Big deal. Because the carbs went up, right? When you take the fat out of things, you add sugar and you add other carbohydrates. So fat doesn't make us fat, usually. It's the carbs, and it's particularly the processed carbs. So you can have all the beans and lentils and broccoli you want. You're not going to get fat from that. But when you start eating processed carbs, and we'll talk more about that, but these sorts of foods, that drives obesity. Walter Willett said, white bread, white rice, white pasta, potatoes, sodas and sweets are 30 to 40% of the calories in the American diet. And he said emphatically, absolutely nothing good about it. It leads only to harm, weight gain, diabetes, coronary heart disease, and cancer. And Walter Willett is our, as I mentioned before, one of our most esteemed researchers in nutrition in the country. He's a physician, and he's the man behind studies like the Physician's Health Study and the Nurse's Health Study. He knows this data better than anyone. So processed carbs on the left and unprocessed carbs on the right. Walter Willett went on to say, choose a wide variety of vegetables and fruit. Don't include white potatoes as a vegetable. Go easier in the fruits that are higher in carbohydrate, such as oranges and bananas and apricots, and avoid fruit juices. So your patients, when you're educating them about what to eat and drink, you know, fruits are okay, but fruit juices, you know, if you have 12 ounces of orange juice, you're getting about 140 calories of sugar in that. It's important for us, and it's important for us to teach our patients about reading labels. This is an example of 2 peanut butters. The Jif, if you read that, it's got sugar, it's got emulsifiers, it's got a bunch of stuff in it. Some people would call that, well, I'll show you what they call that in a few minutes. And then Smucker's has salt and peanuts. That's a great, you know, it turns out the emulsifiers in Jif, those emulsifiers that allow the aqueous portion and the fatty portion to stay together, those also degenerate our mucus layer in our gut and make us more likely to have inflammation along the gut. This is the checkout. You know, yogurts are a great food for many people, but if you're having a yogurt-like food, say Yoplait, you're getting a bunch of colorings and emulsifiers, sweeteners and all of this. So look for a yogurt, put your own fruit in it, and it can be a great food for you. This is the glycemic index concept that I think all of you know about, that if you eat a food, a processed food like those sodas and juices and all of those processed things on the bottom left there, those are immediately or very rapidly absorbed into our bloodstream. They drive blood glucose, they drive insulin, and they drive obesity. They increase our triglycerides, they lead to fatty liver, and all sorts of things. So this food has been, it's been deemed heart healthy. Everybody recognizes this food. It's an oat, right? Well, what happened here is they took the oats, they ground it into a powder, they formed it into a Cheerio, okay? Those things have very high glycemic because as soon as they hit the stomach, they just dissolve. And they're just carbohydrates, and we know carbs are just chains of sugar, right? They're just chains of sugar. Now, if you want something low glycemic, go for these steel-cut oats. They're great. They take hours to fully digest in our system, and they give us a slow, steady state of energy, and we get all of the wonderful fiber that's in the natural product. So if you have a low glycemic meal, meat, vegetables, great whole grains in their whole grain form, like the whole oat or whole quinoa or whole brown rice, that you don't get a bump in the blood sugar, you don't get a bump in the insulin, you don't get a bump in the triglycerides, you feel better longer, you have a much lower likelihood of metabolic syndrome. High glycemic index diet as a risk factor for depression. Women who consumed added sugars were at risk for new onset depression. The more fiber, whole grains, vegetables, and non-juice fruits they had, the decreased risk in depression. So what's at the heart of the problem? Is it the what is that, a New York strip in the butter? No, it's really the stuff that comes in boxes and bags and cans and through your driver's side window. That's the problem. This picture, and some of you may have seen it before because it's a favorite of mine, this is what this middle-class family ate in this week. Now, there's some real food in there, but mostly it's packaged food that's processed in many different ways, and it's not so healthy at all. So, yeah, you can have the steak and the butter, but try to eat all of this other stuff, a colorful diet with lots of different vegetables, have your meat and your fish and your nuts and all of those sorts of things. And then have your sweets once in a while. You don't have to be perfect. None of us have to be perfect. We just want to have the majority of our food. What I'd like to say these days is nutrient dense and colorful and low glycemic. Nutrient dense, colorful, and low glycemic. So butter is back, yes, but limit the bread, eat some beef, fill up on the beans, greens, broccoli, nuts, et cetera, and absolutely don't forget the olive oil. And the way to do olive oil, first of all, you can cook with olive oil in Europe. They cook with it all the time. In America, we say don't cook with olive oil because if you make it too hot, there's a problem. If you smoke olive oil and it smokes, throw that stuff away. That's not good for you. That's definitely transformed in a way that's not beneficial. However, if you don't, you can cook in it all the time. But the way the Europeans use it is they have it on their table. They get a bowl of soup, they pour some olive oil in it. They have some broccoli and fish, they're drizzling olive oil on it. Tablespoons a day, 4 tablespoons a day is good for us and all of our patients. It will lower our risk of cardiovascular disease, and maybe breast cancer is what we saw in that study earlier. On to protein as a macronutrient. The reason why protein's so important, and as I'm getting in my late 50s, I realize this more and more, is that it is hard to maintain muscle mass as we age. We see that in our patients. If we don't maintain muscle mass, it's hard to move. We're more susceptible to infections. And so it's important to have protein with our meals. And it turns out as we get older, some of the machinery, the acid in our stomach, the proteases from our pancreas, they're not as robust as they once were. And our hormones that drive the protein into muscle, the insulin-like growth factor 1, the testosterone, it's also lower. So we really need to depend on more protein. The typical Western diet may have 80 or 90 grams of protein in it, but most of that is the T-bone steak at Outback at dinner, right? And they have little at breakfast. They might have some cereal of some sort, maybe an egg, maybe a little bit more with their salad, some chicken on their salad at lunch. That is not an optimal way to get your protein. We can only absorb about 30 grams of protein per meal. So if we have a bunch at dinner, a lot of that goes, protein, when you get too much of it, gluconeogenesis, it turns it into sugar through our liver. So best to do something like this, have 30 grams of protein with each meal. And when you do this, you will make more muscle and you will lose less. A study done by a man named Douglas Patton Jones at University of Texas in concert with NASA is they put these astronauts to bed for a month. And they fed them the typical way, where they had lots of protein at dinner. Those guys lost more muscle mass. When they gave them 30 grams with each meal, they lost a lot less muscle mass during that month. There's lots of ways to get protein. Obviously the meat and the eggs, but you get great protein from beans and lentils and those kinds of things as well. Yogurt, for example. Greek yogurt's a great source. And so the folks that go out and exercise in the morning are a great thing to do, but if you start your morning with some Cheerios and some orange juice, you're not going to have the protein you need to respond to that anabolic pressure when you exercise to actually build muscle. So 30 grams each meal. This is a little bit about diabetes, the untold secret, and what we tell our diabetics, what the American Dietetic Association tells the diabetics is they should have about 60 grams per meal, and they should make sure they're taking enough insulin to cover that, or enough glyburide and metformin. Well, it turns out that if you limit the carbs to about 50 grams a day, you can make a significant impact on even reversing their diabetes. And I think you probably know this and you can use this in your practice, but I'd encourage you to look at this YouTube video from Purdue. And if you simply Google Purdue University and reversing diabetes, you'll see a TED lecture on that. Amazing reversal. What you do is you get people off carbs. The rapid acting carbs, you put them on vegetables and meats and nuts and fish and olive oil, and their insulin requirements will go way down. And some people will absolutely reverse their diabetes, like a man I had in my clinic this week that started out at about 215, came in my clinic at 178 this week. His hemoglobin A1C was in the 6.4 range, and now it was 5.4 in a matter of months. So the American Heart Association recommends a couple of servings of fish each week. And of course, it's the fatty fish like the salmon that I showed you because of the EPA and DHA. And then there's the fish safety, and the USDA did an absolute about-face on this in 2014. In the early 2000s, they told women breastfeeding and women of childbearing age and pregnant women to stay away from fish because of mercury. What they say now is they should eat more fish because those children that were born of those women that weren't eating fish had cognitive impairment, they had reading delay, they had issues because they weren't getting the EPA and DHA. The new recommendation is 8 to 12 ounces a week for women, breastfeeding, pregnant. But they want to eat the safer fish, right? So the big carnivores, these are the ones to eat, obviously, the salmon and the whitefish and the sardines. And the ones to avoid are the big carnivores, like the albacore tuna and marlin and swordfish, right? Those are the ones they just eat up at the top of the food chain, and they're going to bioaccumulate mercury. Dairy. This was just an interesting review of what the difference between whole fat dairy is and skim milk. Many of us had used skim milk, or 2% or 1%. In boys that have skim milk versus whole fat milk, they have increased acne. In girls that have skim milk, they're more likely to be infertile. There's an increased risk of type 1 diabetes. So why is that? So if you extract all of the fat from the milk, you also have to put things back. You have to put some things like carrageenan back to thicken it up. But it turns out in the aqueous portion that's left in the skim milk, there's more of the hormones that come from the cow, like insulin-like growth factor 1 and estrogens, that affect fertility and acne and other things like that. So I don't recommend low-fat dairy at all. This is information from Dr. Willett when he talked about calcium, and I'll share more about that in a few minutes, but he said that in the Swedish study that dairy intake was associated with an increased risk of all-cause mortality. In the NHANES, in the dairy, he said in cancer that there was a 2.4-fold increase with eating dairy alone, a 2.4-fold increase in prostate cancer. And then interestingly again is that we know there's lots of hormones in these and these milk products, right? Bovine growth hormone, et cetera, that get into us, right? And so boys and women and girls that had dairy often are taller because of that insulin-like growth factor 1. They also have an increased risk of cancer, and they have an increased risk of osteoporosis. In Finland, where they have the most dairy on the planet, they have some of the highest risk of osteoporosis on the planet. So a nutrition summary. Eat veggies, beans, lentils, and whole grains. Fruits of all kinds, and less fruit if you're diabetic. If you're diabetic, you want to eat a lot of berries, high fiber, low glycemic. Eat meats and fish and poultry and eggs, whole dairy, whole fat dairy, cheese if you like, nuts of all kinds, lots of olive oil and sweets, and then, sprinkle a tincture of love, because it really makes a difference if you're tense and agitated when you eat, because it affects digestion. And I think some of you may have seen a study in the last couple of days that if you stress a person the day before, and then you feed them a healthy diet in the morning with olive oil and things like that, and you take another group and you don't stress them, and you feed them a high saturated fat diet, high glycemic diet, and then you test things like CRP and interleukin-6 inflammatory hormones and triglycerides in their blood. When they were stressed the day before, they respond about the same no matter what they ate. I think that's really interesting. So some simple rules about food. Eat food, not too much, mostly plants. I think a lot of you have seen this, Michael Pollan's book. And then one more simple rule: if it came from a plant, eat it. If it is made in a plant, don't. This is a green smoothie recipe. And I really like smoothies. I don't know if any of you have smoothies, but one of the reasons I really like it is that when you blend the food like that, you're going to be able to absorb the nutrients about 30% better. You get about 30% more of those nutrients from the food. So this recipe has some greens, spinach, kale, or chard, 1 apple, 1 cup of blueberries, half a cup of Greek yogurt, 3 cups of unsweetened almond milk, banana, avocado. Avocados are great in smoothies. They thicken them up. Great fat. Ginger for some kind of richness and brightness and flavor. Cinnamon. Mix it up in your vitamin. It's great for you. That's really nutrient-dense food there. And this is that recipe, so you have it to go home with. And there's a nice little YouTube video from a woman named Rhonda Patrick, who's a postdoc at Berkeley, that goes over why you select those ingredients because of the different nutrients in those, the fibers, the specific vitamins. And I said before that you don't have to be perfect, and it's not like you can never have a treat. Oscar Wilde said, "I can resist almost everything except temptation." And when I drive down Route 66 in the middle of St. Louis, I just may make a left turn right into Ted Drew's. I don't know. Some of you have enjoyed that before, right? Yeah, I see some. But I will give you another recipe for guiltless ice cream. And this stuff is good, and it's really good for you. A can of coconut milk, whole fat coconut milk, okay? You want to chill it. 5 cups of frozen berries, whatever berries you like. A little bit of maple syrup. Again, you spin it up. Delicious. Absolutely delicious. That's the recipe. Say just a little bit about sodium. This was a paper, Lancet talked about our instructions to tell people to have sodium less than 2,500 milligrams. They found that even people with heart failure, that you give them on a really low sodium diet, they do worse. And part of the reason is it drives the angiotensin system when you keep it too low. So their recommendations is more of a mid-range, that for most people it's 4 or 5 grams a day. We got to 7 grams, it was a problem. And this was from Journal Watch, and this was their review. Low and high sodium intake appears to have risk. So you want to be somewhere in the middle for most of us. What to drink? Lots of water. Recognize there's lots of sugar in many of these beverages, and if we could do one thing to help our patients get healthier, get them off sugar-sweetened beverages, no question about that. So if you were to have, say, a Starbucks mocha something or another in the morning, have a glass of orange juice, maybe a sweet drink in the afternoon, maybe some sweet tea, and then a beer watching the football game at night, you could get about 1,400 calories from these sweet drinks in a day. That's not nutrient-dense, colorful, might be colorful, but it's not low glycemic, that's for sure. Green tea, we're getting to the end of this lecture, but green tea is an amazing drink as well because it has polyphenols in it, and those polyphenols do several things, and many of these have to do with two particular areas. What it does to phase 1 and phase 2 detoxification really turns on phase 2 detoxification, which allows us to eliminate toxins of all kinds from our body, and it also turns down Jeff?
I have a question.
Sure.
I just finished my fifth cup of coffee.
You're done.
Right. My question is, and I like green tea, am I losing something by drinking 5 cups of coffee and not having green tea? Should I balance? Do I need to add some green tea to what I might have another cup of coffee today?
I think you can do either or. Coffee has been shown to also rev up those detox enzymes. So green tea has some particular things in regards to lowering cancers like breast cancer and actually helping osteoporosis. But I think, Jeff, if you're a coffee drinker, they do well. And they said, basically if it's less than 5 cups a day, there is little harm to that and generally benefit. Green tea is antioxidant rich. It reduces cancer. It promotes healthy bones. And it supports detoxification. And there's coffee, a high source of antioxidants in the Western diet. Lowers the risk of Parkinson's, Alzheimer's, diabetes, and it improves all-cause mortality. That means dying from any reason before you're 75 years of age. And decaf works too. You want to skip the artificial sweeteners, or if you're using one, read it. If it's stevia, good. But if it's stevia plus a bunch of other chemicals that you feel like you have to be a PhD in chemistry to really know what they are, then it probably shouldn't be using it. The other thing, well, coffee's great. I like that. This is one area I'm not going to spend too much time on, but this is an area I'm extremely interested in. And there's an explosion of data about fasting. And this is a study. They used 2,400 women. They were followed for 7 years. They had breast cancer. There was a 36% decrease in the recurrence of breast cancer by a very, very simple fasting technique. There was a 22% decrease in risk from any cause, and guess what that was? What they did is they had them fast overnight for 13 hours, so they can eat during an 11-hour window during the day, whatever they usually eat, from 7 a.m. to say 6 p.m., but they had to fast the rest of the night until the morning. And that too allows for clearing of the liver. It decreases CRP and inflammation markers in the body. It decreases lipids. It also decreases cardiovascular risk. This is really a great intervention for our patients with cancer. A great intervention. There are studies now where let me just say there's many studies with simple fasting techniques. We're not talking about calorie restriction. But when you fast for 13 hours, you mimic some of the benefits of calorie restriction that increases our resilience to many diseases. 1 serving a day of greens, berries, and nuts decreases cardiovascular disease 50%. And food is medicine. And I'll check the time and probably have a minute for questions. Sure. Any questions? Or I can move on to the next lecture, however you'd like to go. Please.